Good evening, and thank you for joining us here on blackdoctor.org. I am Ellis Dean, the Director of Digital Programming and Production at blackdoctor.org, and we are excited to bring this program to you. So I want to thank our friends at the National Eye Institute, at the Children's Vision and Equity Alliance for this series. This has been a fantastic series called Seeing Eye to Eye, and we've had a number of subjects, a number of professionals come in talking all about our vision health. So I'm learning so much more. Just as a side note, uh, I wow people at parties now with the 20-20-20 rule. So Dr. Mary, I know if you're watching, when I do the 20-20-20 rule, people go, "Oh wow, that's a great tip." I'm like, yeah, so it's been fun, and that's just one piece of information that we've learned from this. So today we have two wonderful practitioners here to talk to us about gender disparities in women's eye health and the social determinants of health. And these are two subject matters that people don't really talk about, but they do have an impact on our overall eye health. So we're going to talk about that. We're going to get in there. We're going to roll up our sleeves. We're going to get in there. And now we're going to talk about the problems. We're going to offer up some solutions as well. So stay tuned. In the beginning, though, I would like for you to do a couple of things for me. Number one, let us know where you're watching from. So drop that in the comment section. We'd like to know where people are watching us from all over the world. Earlier today, I had somebody watching from Nigeria. So there are people watching from all over the world. So please drop that in the comment section. Number two, if you know somebody that needs this information or that could utilize this information, please share it on your page. Tag that friend. We want as many people as possible to get this information. And finally, if you have any questions for our panelists, please drop those in the comment section. We will get them asked and hopefully answered to the best of our ability. So that's it. I know you didn't sign on to hear me talk. You came to see our guests and get the information that they have to offer. So I'm going to do a brief introduction and then we're going to get started. So thank you all. So our two guests today are Dr. Janine Clayton. She is Associate Director for Research on Women's Health and Director of the Office of Research on Women's Health at the National Institutes of Health. Yes, that National Institute of Health. So welcome, Dr. Clayton.
Delighted to be here with you, Ellis.
And we also have Dr. Regina Sullivan. She is a Deputy Branch Chief, National Center for Chronic Disease Prevention and Health Promotion, Division of Population Health Surveillance Branch, Centers for Disease Prevention. If you've heard that before, that is also known as the CDC. And I'm sure everybody's heard that. If you haven't heard it in the past 2 years, I don't know where you've been. And I just want to know how you don't know what the CDC is in your life right now. So with that being said, we've got representatives from the NIH and the CDC here. So we are well covered with the alphabet companies. So first question for you, Dr. Clayton. Are there specific eye conditions that women may be more susceptible to than men?
Thanks for asking that. I mean, if you think about the number of people that are blind or visually impaired in the United States, that's over 12 million people in the US are blind or visually impaired. And over half of them are women. And so we do know that there are diseases that are more likely to affect the eyes of women. One of them is thyroid eye disease. The thyroid is a gland in your neck and it creates hormones, and those hormones can affect the muscles around the eye and the surface of the eye. So thyroid eye disease is one. We also know that autoimmune diseases where the immune system, instead of trying to fight off viruses or bacteria, it fights your own tissue, autoimmune diseases. And those are more common in women than in men. And some of those autoimmune diseases are associated with dry eye, where you don't make enough tears or the tears you make are not good quality. And that affects twice as many women as men. Thyroid eye disease affects 5 times as many women as men. And then another category is age-related macular degeneration, which is one of the leading causes of vision loss in the United States. Older women tend to bear the burden of neovascular, new blood vessels forming in this age-related macular degeneration, where the center part of the retina is degraded, and that affects your central vision. So those are a few. areas where we see women being more affected than men.
So, there's a question. The next question is it's a why question. I'm not a fan of asking why question because it's too complicated. So, you just explained several reasons why women have more susceptible to eye conditions,
Mm-hmm.
and so is that more due to genetics or than men, or is it the makeup of the female body versus the male body? What are some of those factors that why women have more eye disease and vision loss than men?
Great question. So one of the factors is because in general, women live longer than men do. And age, as we get older, we are more susceptible to eye diseases and many other diseases and conditions. And so since age is a big risk factor, we see older women with these conditions. So that's part of it. But that doesn't explain all of the difference that we see. You mentioned biology or genetics, and sex being a biological variable determined by your chromosomes, your XX for female or XY for male, does have something to do with this. In fact, we know that on that X chromosome are the genes that code for many of the immune system processes. And so women, for example, tend to fight off infections better than men do. That's a biological difference because of our XX chromosomes. But that puts us at increased risk for autoimmune diseases when that immune system, instead of just fighting off the virus, it's attacking our own tissues and the process isn't turning off.
Okay.
So there are biological differences, but you hinted at another difference, and that is gender-related differences, and that is how we function in society. So women tend to be those caregivers. They're caring for parents, they're caring for partners, they're caring for children, and sometimes they put themselves last on the list and they don't go to get the eye care that they need. And just like getting a checkup for the rest of your body, getting a checkup for your eyes is just as important. And in fact, it can help diagnose things that are happening in your body that you don't know. So part of it's biology, part of it is social factors and whether we have access to care and access to good care, and whether we are seen when the disease is in its early stages, because we know we have, because of research, we have treatments for age-related macular degeneration that can stabilize vision. We have treatments for thyroid eye disease. There are new medications on the market now, but you want to start those treatments as early as possible in the disease process.
Absolutely. Dr. Sullivan, did you want to add anything to that or?
Well, no, I mean, I'm going to let her kind of finish more on that part, but I will come in with kind of getting more detail about the social determinants of health that she hit on. But
Okay.
we can kind of stay with the disease processes before we get into more of the public health aspect around
Got
it.
you. I got you. Because when I heard her hit those social determinants, I was like, I know that's Dr. Sullivan's thing right now. So, we will catch that later on in the program. So, Dr. Clayton, what age should women get a baseline eye exam? I mean, I know there's all these different ages that we're supposed to get something done. Something by 35, something by 40, 45, 50. When should women get a baseline eye exam, regardless of any symptoms? And why is it important to get that baseline eye exam?
I'm really glad you asked that. And you said, regardless of any symptoms, if you are having symptoms of blurred vision or pain in the eyes, you need to go right away to get your eyes examined. But if you're not having symptoms, we say that you need to have at least one eye exam, a complete eye exam by your ophthalmologist once in your 20s and twice in your 30s. Okay. And then if you haven't had one, certainly by your 40s, you need to be seen. 40 is one of those magic numbers where your arm starts seeming like it's not long enough and you can't see things that are up close when you develop something called presbyopia. And so if you've not seen an ophthalmologist by then, now there's some caveats there, Ellis, and that is if you wear contact lenses, you need to be seen every year. If you wear contact lenses, so many women wear contact lenses. In fact, more women than men wear contact lenses. And if you have conditions like diabetes, which can affect the inside of the eye, you absolutely need to see a doctor, an eye doctor, more frequently. Ask your family doctor when you should go if you have conditions like diabetes or high blood pressure, because both of those can affect your eye health.
And to add on that, one reason, a lot of times women go into presbyopia earlier than men, and that's a disparity. And the reason is simple: women have shorter arms than men. So as a result, we'll go into that phase a little sooner.
Yeah.
It's interesting. The beautiful thing is that because of our relationship with the Eye Institute and the CBEA, we've started working a program with Dr. Joseph Coney. I don't know if y'all know him, out of Ohio, and we do a program on diabetic retinopathy. And so we've been learning about how just diabetes really has impacts our eyes in a significant way with development of extra blood vessels and pooling, and we can really lose our vision very, very quickly. So I've really learned a lot during that series with Dr. Coney. And so absolutely right, there are a lot of determinants that Dr. Sullivan is going to talk about, but there are some health conditions that are contributing that are impacting our eyesight. And I think the beautiful thing about this program and other programs like this is that we're trying to help people connect the dots with all of these health conditions. There's nothing that's in isolation. Diabetes is not just the sugar. It impacts a number of systems in our bodies in different ways. And so the beautiful thing about seeing an ophthalmologist is sometimes they can tell you ahead of time, oh, did you know you might be pre-diabetic, and just from an eye exam. So it's very important to continue on those things. So that's my soapbox. I'm learning. You see, I'm here. I represent the people right now. So
absolutely. And Ellis, did you know that when diabetes affects women, they're more likely to have the heart complications of diabetes than men are? Even though diabetes affects men and women develop the heart complications, those cardiovascular complications, more frequent, earlier than men do. So all information that we should be thinking through. And like you said, your body affects your eyes, and your eye health affects your body. And many Black women are hypertensive or have high blood pressure.
Right.
And over half, in fact, of Black women over a certain age have high blood pressure. And many don't even know that they have that. And that's also something that you can detect when you look at the blood vessels in the back of the eye. Right. We ophthalmologists, we can see your blood vessels when we look into your eye, and that gives us clues to what's going on in your body.
Right. That's fantastic. We could okay. All right. So here's an interesting question, and these are specific for women. Do life changes like pregnancy or menopause have an impact on vision? And what would you like your female patients to know about the possible effects of menopause on their eyes?
That's a great question. We say that pregnancy is a stress test. And I think any of us who have been pregnant will tell you it is indeed a stress test, and it can predict your future health. And so there's some things that can happen during pregnancy, conditions like preeclampsia, where your blood pressure goes up very high, and that can affect the eye as well. In fact, there's also a special kind of diabetes that can develop during pregnancy only. That's called gestational diabetes mellitus, and that can affect the eye. Even your contact lens or your glasses prescription, which has been working fine for you, can change during pregnancy. All that fluid that you're retaining, all that blood volume that you need to expand to support the baby, that can affect the refraction, the curvature of your eye, and can make your glasses not work as well. So any sign of blurred vision, headache, all of those are really important during pregnancy. And you talked about another special part of a woman's life that all of us will go through if we're blessed to live long enough, and that is menopause. And during menopause, we see changes in hormones. We see changes in the lipid profile, your cholesterol, how well you can manage. We see metabolic changes. Those you need to exercise more to stay at the same exact weight. And those hormonal changes are actually associated with a time when we see dry eye tend to develop right around menopause.
Okay.
And so that's something that women over 50 have twice as, are twice as likely to have dry eye, and that's around the age of menopause in the 50s. So those are a few things that we see specifically for women.
Wow. All right. So I'm going to do a quick recap. So we've got, you should get that one ophthalmology appointment without symptoms in your 20s,
Yes.
2 in your 30s. If you are wearing contacts, and that's every year. So that if you have glasses or contacts, throw that out, go every year because you're mature. But if you have 2020 or 2030, somewhere in that range, 2010, once in your 20s, twice in your 30s, and then after 40, that magical time gets more. Pregnancy is a stress test, right? So your body's going to go through all kinds of changes, and that you can kind of see and get kind of get an example. Hey, there could be some things to go haywire when you get pregnant, so just kind of watch that. And then also menopause on the backside, you're going through those changes, that could have some impact on the eyes as well. I will add one other piece to that when we're talking about diabetes and those other conditions. Obesity is kind of like a starting point for all of that stuff, right? Hypertension, inflammation, diabetes, all of that. So if your doctor is saying that you are or obese, then we might want to kind of control that, because that can kick off a whole bunch of other complications associated just with obesity. So
you got it.
it's fantastic. All right, so I think I did good. I did good on my summation. All right, so all right. So how can women make the most of their eye visits with eye health providers? And so I've learned this from Dr. Coney. He said that a full eye exam must include dilation. Is that true?
Absolutely. Absolutely. A full eye exam includes dilating the pupil so we can see all the way inside the eye and the retina. It's the front part of the eye muscles, the eye pressure, the dilated exam. We are checking out every part of your eye so that we can make sure that there's nothing wrong. And the thing that a woman could do to best make the most of her visit to an eye care provider is to know your body and to speak up when something is wrong. I tell people in my family, anyone who asks, you have to be your own best advocate. You are the world's expert on your body. If something isn't right, you will know, and you need to speak up. And sometimes it's hard to talk about things that you're not sure about. So I do think some folks sometimes take a friend with you or a family member, or write down your symptoms. I notice I see flickering lights, but only when I'm outside, or make notes of the questions you want to ask. I do that myself. I put them on my smartphone, because you get in the doctor's office and you forget what you wanted to talk to them about every time. Like, I can't believe I waited for this time and then I didn't ask this question. So I do it too. Write it down in your smartphone or on a piece of paper, and speak up about what you're concerned about. You are the world's expert on your body.
Absolutely. I cannot co-sign that anymore. So what can women do today to protect their vision for the future?
So there are some great steps we can take to protect your eye health that also protects your heart health and your brain health. Namely, eating a low-fat diet. Actually, that affects your eyes. Exercising.
Mm-hmm.
Refraining from smoking. Smoking, we know, is bad for your lungs, increases your chance of lung cancer. But did you know smoking is bad for your eyes? Mm-hmm. It increases cataract formation. It affects the blood vessels in the eye. So another thing you can do is to wear sunglasses when you're outside to keep the sun rays, those UV rays that affect your eyes. Protective eyewear if you're going to go doing any metal work or trying to hang up some blinds or working with bleach or other cleaning chemicals, keeping your eyes protected with safety eyewear. If you wear contacts, make sure that you wash your hands well before you touch those contacts and touch your eyes, and replace those contacts regularly, and give your eyes a rest. Ellis, you said the 20-20-20 rule. If you are working on a computer, you want to share that 20-20-20 rule with our colleagues and watchers?
Every 20 minutes, you should look at something 20 feet away for 20 seconds.
That's right. So you can do a lot to take care of your eyes.
And it does something to relax the, I don't know, like at that point, I'm over. But I do know the 2022 rule.
No, you got it. You got it. It relaxes the eye muscles that you
Relax the
focus.
eye muscles to keep that stress so it doesn't elongate, and that's what happens too. Okay, so I did get that. I did pay attention enough. I did always sit in the very back of the classroom. Maybe I was in the middle of the class. I know doctors, y'all sit in the front of the class, but the rest of us, we kind of get it. But it's really important that those things, because they're very important. Because if your eyesight goes, it doesn't come back, right? And we know how much of our activities, just in all jokes aside, how many of our activities, daily activities, are attached to having good eyesight, right? Even what I'm doing here, typing, driving, there's a lot of things. It can severely impact our lives in a very significant way. And I know Dr. Sullivan, you're going to talk about those determinants in a moment. It can severely impact. So we have to protect our eyesight. We have to protect our overall health, but we really have to protect our eye health because how dependent we are on our vision in our daily lives. So that's my soapbox statement. So closing question for you, Dr. Clayton. So Dr. Sullivan, we're coming right around your block in a minute here, is why should Black women make eye health a priority?
So you touched on it just now, Ellis. You said that vision is so valuable to our livelihoods, our ability to have money, make money, to take care of ourselves, and recreational activities, and to enjoy life. Yeah. It's a sense. Vision is a sense that people uniformly value. If you ask them, how much time would you trade for years of going blind? I mean, people value their vision clearly. And also when people lose their vision, it can affect their mental health. Right. Actually, vision impairment, it's associated with risks of anxiety and depression. So Black women should make their eye health a priority in the United States because we're more likely to have glaucoma, diabetic retinopathy, hypertension, and all these can affect your eyes. And so those are ways that we can take care of ourselves and to be able to contribute to society, to contribute to our families, and take care of those around us as well. Making yourself a priority is not selfish.
I cannot say that any further. And I just learned from our previous program that loss of vision is a contributing factor to Alzheimer's. So when we're talking about just how much our vision is connected to other conditions and other conditions are connected to our vision, just think about that. So thank you. That was fantastic. Dr. Clayton, look, Dr. Clayton, you're doing it. So Dr. Sullivan, I know you're coming. I know you're ready. You're stepping up to the plate. So now we got to shift to something that is less concrete. So when we're talking about the physical, those things, diabetes, those things are very, very, very concrete. But when we're talking about social determinants, those impact us in ways that are very, very more subtle. So we're going to really kind of get into those subtle ways that the determinants of our health and those risk factors and how they influence those concrete items like our physical being. So first question for you, Dr. Sullivan, is can social factors such as where a person lives and how much money a person makes increase their risk of vision loss? And what are some of those social determinants of health? And why are they important in our overall health, but more importantly to our vision loss or our vision health?
Well, thank you for asking. But first of all, I want to say that anything I say in this session is basically represents myself and not officially the viewpoint of CDC. So I'll put that disclaimer out there.
Got to cover the all
right. So we have what's called the Vision Health Institute website. And on that website, I'm going to direct it to you later on. But basically, yes, social and many other factors can increase a person's risk for vision loss. These factors are subtle, things like where you live, where you go to school, how much money you make, the environment you work in, your neighborhood environment, even the stores in your neighborhood can all kind of affect how your health outcomes for you. And I want to say some of the 5 main domains that we follow at CDC would be healthcare access and the quality of that healthcare. We look at neighborhoods and your built environment. Again, that would include stores. Your social community context, like certain social types of events or activities in that neighborhood. We
Right.
look at the economic stability in that neighborhood. We also look at access to education and the quality of that education.
Mhm.
Now, these are the key factors that we look at that can contribute to what we call health inequalities. But the bigger factor is, yes, we know about all these different social determinants of health, but how does that affect your eyes directly?
Right.
That's the question. So when we look at a paper by Dr. Zhang, um, we look at things like, for example, let's say food insecurity in your neighborhood. Well, that will affect your diet. Your
Right.
diet will affect whether or not you can control your diabetes, which
Right.
again leads to diabetic retinopathy if you can't keep it controlled. The other thing is just access to doctors. I mean, access to ophthalmologists, access to optometrists. If you're in a what we call like a medical desert where you can't
Mhm.
get to your eye doctor or your optometrist or ophthalmologist without going through a whole bunch of hoops and whistles and different things to get to see them. Another thing that can kind of relates to the social determinants of health or are basically maybe your neighborhood safety. For example, if your neighborhood is not necessarily safe for you to walk or for you to go out and exercise and enjoy things, well, that's going to affect how you can control your hypertension, how you can control your diabetes. And again, all that feeds back to your vision and how you kind of care for yourself. So that's kind of the what we kind of start to track when we look at social determinants of health, or those kind of I call them maybe upstream factors that eventually factor in and kind of affect your vision down the road.
Yeah, yeah, you touched on a great many of those. I mean, and we talk about that all the time in terms of just affecting overall health. And I know tonight we're talking about vision health, but just really those risk factors in terms of food deserts, not having access to healthy foods. A lot of times, impoverished neighborhoods, especially Black impoverished neighborhoods, are built next to uh, high pollution areas where there's a lot of car pollution, factory pollution, just really roads, highways that really can contribute to overall lack of health. And then if your corner store only has a lot of high processed foods with fats and sugars and salts, then that can lead to obesity, diabetes, hypertension, all those things. And those are factors that have impacting our health. And so really, we have to do, I think Dr. Clayton made that great point about being your own best health advocate. We have to kind of find pathways to overcome some of those circumstances, and then we could work on the other side of changing those circumstances for the entire community. So, what is the CDC doing to address these social determinants of health that are contributing to vision loss?
Well, again, I'm going to cite the CDC's Vision Health Institute. They have several different things going on, first of all, but
Mhm.
I would like to kind of highlight Prevent Blindness North Carolina.
Okay.
We are kind of partnering with them. They're working with a low income women of color, where they found they were more likely than other groups to have problems getting vision care and eye care. And this Prevent Blindness partnership with the CDC Wise Women program to include vision screenings as a part of a preventive health screening. So basically, when they were doing like mammograms or different things in the area, they also decided to do kind of health exams vision exams or screenings at the same time, thereby kind of reducing like an access to care type thing.
Mhm.
And again, there's another example of Prevent Blindness, Texas and Wisconsin, which also kind of worked in the public health departments and taught people there how to do adult screenings. And they increased the information to refer clients to the appropriate eye care resources. They set up different ways for them to get vouchers for eye exams and for glasses, things of that nature. And there's another Prevent Blindness group that we worked with, Prevent Blindness Ohio. They're with the Ohio Department of Health about, they did a program called Wise About Eye program. This program provided vision screening certificates and equipment to primary care clinics, school nurses, and Head Start staff. And basically what they did is they kind of did a train the trainer type of thing where they taught maybe school administrations and school nurses how to look for vision care, different indicators in children as young as 3 years old or older. And then if they found anything, kind of referring them to eye care specialists like optometrists and ophthalmologists. But that's just a few of the partners that we work with. When it comes to some of the things that we're doing and partnerships, we have several grantees that we work with as well.
So this question for either one of you, and it just kind of popped into my head, so I apologize. But, sometimes we get, we consider certain doctors that we go to when we're young, and we don't think about it when we're old. And going to the dentist is one of those things. Parents are always taking their kids to the dentist, and then when they become adults, nobody thinks about going to the dentist. Same thing with vision of your child. We're all over it, but then we become an adult. If I polled my friends right now how many went to go see an ophthalmologist, you would be
optometrist.
Or optometrist, you'd be very disappointed. I would be disappointed. I'd be like, oh, but I didn't really, So how do we get? I guess the question is, how do we elevate the position of your eye health and getting your eye health checked regularly, like you would go for your annual physical appointment? How do we elevate that so people really are on top of that and not waiting until cataracts and glaucoma and all these other conditions start to form?
Yeah, so I'll go ahead and kind of answer that. In my opinion, I think a lot of times it's just access of care and making it convenient. I mean, if you can put it in the primary care practice, and that's what a couple of the things that we are, and I'll hopefully we'll touch on that later on in my questioning or in my answers, is that if we can make it more convenient so that it's all in one spot, it might make it more likely for them when they go to get their physical to also get their eye exam or also even go see the dentist is that. So I think a lot of it is just convenience. Life gets busy, especially the older you get, and the more convenient you can make things, the better.
Absolutely. Ellis, you mentioned that, we do that with our children and that becomes a habit. Right. So anything that can become a habit, you can continue. I tend to tell folks, your birthday is a very special time. You are grateful to have made it another year. That's a time to get your mammogram, your breast cancer check, get your pap smear, update any vaccinations. We've got flu vaccine. We've got COVID vaccine. We even now have a shingles vaccine to prevent you from getting shingles. As a person who's had shingles, you want that vaccine. And, actually the shingles vaccine works a little better in women than in men. And in fact, when women get shingles, they're more likely to get the eye part. It can affect your eye as well. So making it a habit by saying your birthday is a time where you are thinking about yourself and you're grateful for that time. Take that time, get your mammogram, get your eyes checked, realize that you can prevent poor vision outcomes by seeing your eye care provider. So we can detect that early. We have treatments for those problems.
All right. So y'all, I'm going to make it plain. So when you go and get that $5 bill pinned on you on your birthday, make sure that pin in an appointment slip for the eye doctor. There
we go.
$5 in an appointment slip. Put it right there on your jacket or your lapel. Okay. So Dr. Sullivan, the CDC does a lot of surveillance of health issues. And so we know that's one of the positive things, or one of the many positive things about the CDC. So tell us about the vision and eye health surveillance system and the behavioral risk factor surveillance system and why these are important important? And how can this data be used to improve access to healthcare?
Okay, well, first of all, let me with the word surveillance. Let's kind of break that word down. I know when you talk surveillance nowadays, you're thinking about some drone flying around or things of that nature. That when
Especially
we
with
talk
Black
about,
folks, we get touchy when you start talking about surveillance.
I know. So let's break that down first.
Please.
In public health, when we're talking about surveillance, we're usually talking about a group of questions. Questions that we work with stakeholders to kind of figure out how best to find out different things or different data points to help us know more about the community. So when we talk about surveillance, we're talking about these questions that usually go out in the form of a phone survey. It goes out to, just about anybody at random in the community, and they have no obligation to answer. We always hope that you will provide, will participate in the survey, but it's completely optional. All the information is declassified, so we know nothing about the person or the people that answer this question. But it is very helpful when it comes to finding out more about what's going on. So that's the first thing. It's just defining what we mean in public health when we say the word surveillance. Now, so now we have what is called the CDC National Vision Health Eye Health Surveillance System. In this system, I recommend everybody kind of go to it when they get a chance. And the beauty of this system is that it gives you elaborate maps that show you where in your neighborhood or in your state where you have people who say that they can't see even with their best glasses, or they consider themselves blind. You have places where it'll tell you, when the last time they had their eye exam or things of that nature. And you ask, well, what's the benefit of these beautiful maps and all these data points to show us what's going on? Well, it's actually a new thing in that surveillance for, finding out who needs vision help in certain areas to this level hasn't really been done before. And the fact that it's absolutely free to the public. Grassroots organizations, your average student, your university professor, your lawmakers, anyone can go and visit this particular website, look at their state. They can pick out what questions or what they want to display. It comes up in these beautiful state maps that show bar graphs and different things. And well, what can you do with that information? You can show it to your community. You can show it to different shareholders who might want to do something about it in your community. So that's what those data points are all about. Case in point, I know I personally work with the Behavioral Risk Factors program, and we're reaching out to try to build or make our data more accessible to people. So we're reaching out to groups like NAACP just to let them know, hey, we have this data set that can show you the burden of or the cost of vision loss in these particular states that may be of interest for you, to kind of figure out, where you want to target resources or what you want to do. We always have students that come and get this information, and they'll either make a report on it or do their thesis on it, or you have like state representatives who may want to show, okay, this is why we're going to make this particular policy because this is where we find the need. So I encourage everyone to kind of put your tax dollars at work and go and visit these sites and see what it inspires you to do for yourself or your community.
So all surveillance is not bad.
No, not our surveillance is not bad.
But also, it seems like I think you're doing it on the right track. The CDC is on the right track in terms of partnering with community-based organizations, faith-based organizations that already have a track record and trust in the community, and say, okay, we're not here to get your information. We're not here to track you. We just want to help you and get an understanding of where these high levels of concentration of poor vision are, and then what are the factors contributing to that so we can help alleviate that. So that's what the surveillance is about. So we got to trust a little bit. We got some great people here that are not trying, they're really trying to help. So trust them. Trust Dr. Sullivan. She's going to take care of you. Okay. So call the CDC and say, ask for Dr. So Dr. Sullivan said that I was going to be taken care of. So,
and that this information is free. You can go on there and get it for free.
Absolutely. We like free. I love free all day long, free. So the CDC is also known for their public health programs and initiatives to help alleviate health disparities. What are some of the CDC's programs that are designed to help with vision health disparities that our viewers should know about?
I'm going to draw attention to one that I kind of like a lot, and that's CDC's partnership with the University of Michigan. And what that is, it's kind of like what I mentioned before, but they're kind of doing an evidence-based model of it, where they're going to health departments. They're providing these people called ophthalmic technicians, which is a fancy way of saying an eye nurse. So when you go... So when you go in to get your routine eye exam to check for diabetes or for hypertension, again, those we actually recommend that if you physically have been diagnosed with those, that you also get a routine eye exam to kind of go with it, because the results of that help your primary care doctor figure out if they're controlling your diabetes or your hypertension to the point where it's not causing any eye damage. So we always want those things to kind of go side by side. But in this particular model, they put an ophthalmic technician in there that will take eye pressures, will take different measurements virtually, and then, in person, and send all that information virtually to a doctor that's off-site. And while they're doing all that, they actually help the patient to pick out glasses. So it kind of becomes like a one-stop shop. And they're looking at, this is particularly right now more of a research project, and they're hoping to maybe make it more upscale, or just see how well it works later on. But I wanted to kind of draw your attention to that, because that is something that we see being kind of promising maybe in the future or down the road.
No, it sounds promising. We just got to put a different name on the person, because I can't go in there and say, I'm not going to say no. Eye nurse.
Call her eye nurse.
I need to see the eye nurse. That's what I need to see. My Southern tongue is not going to say ophthalmic technician too many times. So
I got you.
I would tell that, but it makes sense. And I think, so a lot of this is really tied to, she's saying research, but there is a whole space for clinical trials. And so I know we've been talking about that's a hot term right now, and it's very, very important for us to get involved in those clinical trials, because they give us a lot of information, a lot of data to improve. And it's not just for medications, just improving treatment methodologies, interventions, all of these different types of things, should even down to, is it better to take this medication in the morning or at night? Is it better to take it with food or without food? So all multiple types of interventions, including the development of new medications or medication combinations, are all part of clinical trials. If we don't get involved in those clinical trials, I'm saying we in terms of people of color, if we don't get involved in these clinical trials, what can happen is the intervention that's developed is not going to be as impactful for our community. And then that's when we get into that cycle of, one day I tried this medication, didn't work, so I stopped taking it. Well, it didn't work because there wasn't enough Black people involved in the development of that medication. And so now, or you might just need to take more of it, because as a Black person, you might need 1.5 pills versus 1 pill. But we've got to get involved in there so doctors will know the dosage amount and the proper interventions. Another soapbox that I'm on, but I think when you're talking about research, that all falls under that umbrella of clinical trials.
And I'm so glad you hit on that. I'm so glad, because the one I mentioned, which is called the Screening Intervention for Glaucoma Eye Health through Telemedicine, actually is accepting applicants at this time. So You can do a Google search, and I think they have 3 different partners that they're working with, which is University of Columbia, University of Michigan, and the University of Alabama at Birmingham. All 3 of those grantees are still accepting people to participate as part of those research projects.
Right, UAB, I know there's plenty of folks down there at Birmingham. It's a high Black population, so absolutely, I'm sure they could find some Black folks to participate. So thank you for sharing that information. So what steps can patients and their caregivers take to help individuals with vision loss maintain mental health wellness? And I think I'm so happy this is part of it, because mental health is my area, and we tend to, earlier in healthcare medicine, we tend to separate that out. And it is a part of every diagnosis. There is a mental health component. So we'd love to hear some strategies for keeping ourselves mentally healthy and positive. How can we live our best lives?
Well, first of all, I want to address the caregiver, and it's very important that caregivers, who are usually women, a lot of times, we get routine eye exams and update our glasses. So many times we ignore our own health because we're focusing on others. And I like to share that analogy that we kind of all are familiar with. If you've ever taken a flight, the first thing the captain or the stewardess will say, in case of an emergency, put the mask on yourself first, then help the passenger next to you. This is very important in life too, because it takes a lot of energy, time, and patience to care for someone. And if you're not focusing on your health, how are you going to be there for the person you're taking care of? And like we said earlier, a lot of people don't realize that blurred vision and reduced vision can mentally affect you. It can kind of lead to depression, increase your stress levels, and it can even increase your chances of falling and injuring yourself. So the main thing I would like to stress is that caregivers, make sure you get yourself a routine eye exam first. Then and update your glasses if they're scratched. I noticed a lot of times when I was in practice, people would have these glasses that are 3 or 4 years old, but they were full of scratches. So even though the prescription may have changed, you're still having a really hard time seeing out of them because they're all scratched up. So make sure you update your glass prescription and lenses. If your lenses are scratched, get them replaced. And then when the person that you're caring for, make sure they get a routine eye exam. And, a lot of times I think stress causes just it accentuates a lot of health issues. So work on your stress. Things like, find what works for you. I personally like yoga and meditation, but I know other people who love to listen to jazz or walk in nature. You have others who kind of like to just simply, kind of sit back and maybe read or maybe look at videos. Whatever you can find to help you to reduce that stress for yourself and the person that you're caring for is going to kind of make everything a little bit better. Now, I want to end by saying that we also have a program that's called Stopping Elderly Accidents, Deaths, and Injuries, because, when we're dealing with vision loss and we're caring for someone, especially who may be elderly with vision loss, their chances of falling are a lot higher. What can you do about that? You can make sure that they can see. You can make sure that there's clutter off of the floor. You can make sure that throw rugs are taped down and not slipping. You can put up grab bars for bathroom rails, and you can make sure that the house is well lit. And believe it or not, little things like Tai Chi, which is one of those slow kind of meditative movements, have been shown to kind of help with stability and helping people who may be a little bit kind of wobbly on their feet move a little bit more with more kind of confidence in their movements.
I am dropping. So for those that are watching us, thank you again. I am putting in the comment section some links to some websites that you can get some more additional information. Some of them with the CDC. So the Vision Health Initiative, I've already dropped that in there, and I'm about to drop in the link to the Social Determinants of Health, because we want to make sure that this program, the hour that we're spending with you, we're planting a seed, but you've got to water it. You've got to put the fertilizer on it so that seed can grow, and then you can improve your health. If you just take this hour and only satisfy with this hour, there's some great information here. And Dr. Clayton and Dr. Sullivan are very, very knowledgeable, but we can't get it all out in an hour. So there's some resources that are available to you that I'm trying to put as many links as possible. Go to the National Eye Institute, the Children's Vision and Equity Alliance. There's a whole bunch of resources out there for you about your eye health. So please, please, please do some follow-up after this. And if you only do one thing, what you got to do, Dr. Clayton, you got to make that appointment. You got to make that appointment with your eye specialist.
That's right.
All right. So last question, and I know this is not completely eye related, but this is October, and we know the elephant in the room is breast cancer awareness, right? And so when we're talking about healthcare disparities, particularly as it pertains to women, we do have to talk about that. And so let's, the question that we have here is when we're talking about Breast Cancer Awareness Month, is we want to remind women to get their mammogram. So either one of you, this question for both of you, would you like to comment on making sure and why it's very important for women, particularly women of color, to get their mammograms?
Right. Happy to get started here. We know that while the incidence of breast cancer is higher in white women than Black women, more Black women die of breast cancer than white women. And there are particular forms of breast cancer that can be very aggressive, and they're more frequently seen in Black women as well, triple negative breast cancer. And so it's really important for us all to get screened with our mammograms, because we know we can detect early lesions on early tumors, early masses on that mammogram. And if we detect it early before it's spread outside of the breast tissue, we have a much better chance of having a good outcome. And we have so many medications and treatment options today. So we want to have everyone have their mammogram and get it detected early. Unfortunately, Ellis, during the pandemic, many people had to postpone or put off their routine screenings. But it is October, it's Breast Cancer Awareness Month. We want everyone to get back on their schedule, get your mammogram, get your pap smear, do the other things that you need to do to screen for these cancers that have treatments. Unfortunately, and you also mentioned earlier about, being in a clinical trial, and you talked about how it's not just about drugs or new treatments. I want to add that it's important for all of us, especially those of us from underrepresented groups, to be in clinical studies, because sometimes a clinical study just needs to get a baseline normal for a population. And if you don't have anyone that looks like me in the study, then the doctor who's treating me is making treatment decisions based on data from somebody not like me, and we know that women used to actually be excluded from those studies. We've come a long way from that regard. Over half of the participants in NIH studies are women, but we need to see more in terms of that racial and ethnic diversity, both in the study investigators, the nurses, the people that fund the research, people that work at NIH like myself and others, so that we can make sure we ask questions that are of importance to all of us. Because we know when we have diverse teams, we get better answers. We call that the diversity dividend. Literally, we can solve problems faster, we come up with more solutions, and it benefits more people. So that's my soapbox for tonight, Alice.
Fantastic. So, Dr. Sullivan, did you want to add anything to that about making sure you get mammograms?
Well, just to make sure that you get them, and I agree. Diversity is strength.
Absolutely. So the last piece I'll say that as we're closing up here, please check all the resources I put in the comment section but also in terms for women of color, understanding that Black women tend to develop breast cancer earlier in life. And so if you have, especially that triple negative, which is very, very aggressive and very, very hard to treat. And so the earlier the detection, the better the outcomes. And so we really, really have to stress that. Even if you're younger, if you have a young daughter, talk to them about self-exams. And then as we get older, start getting those regular mammograms. I love what you said about taking that birthday and making that a health day, right? And yeah, I know we like to go to parties and we're doing the thing. It's a birthday week, it's a birthday month, however you want to celebrate it. Make it a week and then take that week and make those appointments that week. We are getting savvier in healthcare in terms of we understand that everybody cannot go to the doctor between 8 to 5, Monday through Friday. There are some offices that are open on the weekends. They're opening later. They're staying open later. So more people can engage or recognizing, getting that feedback that's saying, hey, I can't take off from work. Social determinants. I can't take off from work to do a whole day and I can't get all my appointments on the same day. So they're trying to become more flexible in that. Please lean in, understand, but if you don't get involved early, later on, we might have some more dire consequences. So I want to thank our friends at the Children Vision Equity Alliance. I put that website in there. There's a number of the CDC, the NIH for letting us borrow these two wonderful, wonderful practitioners out there on the front lines, making sure that your vision health is protected and they're getting all the information we can. So thank you again. And thank you, Dr. Stephanie. Mary, I always give her a shout out because she has been a fantastic partner for us here at BDO in terms of really bringing vision health to the forefront to our audience. So thank you all for joining us and staying with us. And with that, I say, have a good evening.
Thank you.
Thank you.